You were told methotrexate is a game changer, but nobody warned you about the nausea, the mouth sores, or the dreaded liver warning. Sounds familiar? Most methotrexate side effects are manageable. I'm going to show you exactly how, with proven evidence-based strategies you wish you knew sooner. Methotrexate is the gold standard for conditions like rheumatoid arthritis and used for multiple other autoimmune diseases such as psoriatic arthritis and lupus. It reduces inflammation, protects joints, and improves quality of life. Like any powerful tool, it comes with risk. The good news, with the right game plan, you can minimize or even eliminate most side effects. Let's dive in. Methotrexate can be brutal on your stomach, but there are always ways to make it easier. One of the best strategies is taking folic acid. It's not just a supplement, it's a game changer. Folic acid protects your body from methotrexate's harsh effects. It reduces nausea, mouth sores, and even liver toxicity. Another possibility is taking a type of vitamin called leucovorin. This is taken once a week, about 10 hours after methotrexate. Another option is switching from the pill form of methotrexate to the injectable form of methotrexate. When methotrexate is taken as an injection instead of a pill, it completely bypasses the stomach. Many people find that the simple switch eliminates their nausea altogether. Splitting the dose can also be helpful. Instead of taking your full weekly dose at once, breaking it into 2 smaller doses taken 12 hours apart can make it much easier to tolerate. For those who still struggle, anti-nausea medications like ondansetron can make a huge difference. Methotrexate doesn't just affect your joints. It can impact your liver too. That's why routine blood work is critical. Doctors typically monitor liver function every 4 to 8 weeks at the beginning, and then once things are stable, every 8 to 12 weeks. If your liver enzymes rise to more than twice the normal limit, your doctor may need to adjust the dose or stop the medication altogether. Alcohol. Alcohol is another major factor with methotrexate. Methotrexate and alcohol don't mix. Even small amounts in certain people can increase the risk of liver damage. Many doctors recommend avoiding alcohol completely while taking methotrexate. In certain people, small to moderate amounts of intake may be safe. I'll cover this specific topic in question and go over the evidence in a future video. Other medications can also be a problem. Non-steroidal anti-inflammatory drugs like ibuprofen and even things like acetaminophen, the main ingredient in Tylenol, can put extra stress on the liver. Before adding any new medication, even over-the-counter ones, it's always a good idea to check with your doctor. Methotrexate can suppress the bone marrow, which means it can lower your white blood cell count, your red blood cell count, and your platelets. This is why routine blood tests are so important. In the first few months, most people recommend testing every 4 to 8 weeks, and once things look good, every 8 to 12. Folic acid plays a role here too. It helps keep white cells and healthy and also reduces the risk of anemia. But in some cases, methotrexate can still cause dangerously low blood counts. This is more common at high doses and in people with chronic kidney disease. If your white blood cell count drops below 3,000, or if your platelets fall under 100,000, doctor may need to lower your dose or pause treatment. In severe cases, doctors use leucovorin, a form of folinic acid, as a rescue medication. It can quickly restore blood cell levels and prevent serious complications. Methotrexate pneumonitis is a rare but serious condition. It's not an infection, but rather an inflammatory reaction in the lungs that can develop. The first signs are usually persistent dry cough, shortness of breath, and fever. This is a medical emergency. If you develop these symptoms, stop methotrexate immediately and call your doctor. Corticosteroids are sometimes needed to recover the lungs. Some patients are at higher risk, especially those with pre-existing lung disease. If that applies to you, your doctor may recommend regular lung function monitoring. It's important to note that the symptoms of pneumonitis could be caused by other conditions that are completely unrelated to methotrexate. Some examples include blood clots to the lung, also called pulmonary embolism, pneumonia, etc. It's always important to have a wide differential diagnosis. Methotrexate pneumonitis is rare, very, very rare, and typically occurs within the first year of therapy. Hair loss from methotrexate is usually mild, but it can still be distressing. Biotin supplements may help, though they don't work for everyone, and there may be contraindications for treatment with biotin. Good news is that methotrexate-related hair loss is usually temporary. It is not scarring. If it becomes severe, your doctor might adjust your dose, and again, possibly stop the medication altogether. Mouth ulcers are another common. If you're dealing with painful sores, a medicated mouthwash or topical steroid gel can provide relief. Folic acid, once again, can help prevent them from forming in the first place. Methotrexate is not safe during pregnancy. It can cause serious birth defects, which is why strict contraception is essential while taking this medication. Women need to use 2 forms of birth control and continue using them at least 3 to 6 months after stopping methotrexate. Blood level can definitively determine whether the medication is out of your system. For men, some research suggests methotrexate may temporarily affect sperm quality, but there's no strong evidence that it causes long-term fertility issues. Methotrexate can be life-changing, but side effects don't have to take over your life. With the right strategies, you can get the benefits without the burden. Take folic acid, monitor your blood work, talk to your doctor if side effects become overwhelming, and don't ignore symptoms that could signal something serious. If you found this video helpful, hit the like button, subscribe for more health tips, and leave a comment. What's been your biggest challenge with methotrexate?